Yeah, thank you very much for the invitation, and it's really a pleasure to be here and in a region that seems to have understood how important it is to think about, well, we have learned today not about population aging, but about the fact that there is an increasing share of older people in our societies. And yeah, I was now thinking, what could I really bring to you as you have developed already such a lot of strategies, ideas, projects. Why should I tell you something about why it is necessary to have an integrated system of long-term care if you talk about healthy aging? And I think it is always, again, important to underline this fact. We had it also in the round before, where we saw a number of rather privileged active pensioners, but we also heard that there are so many differences between groups. As we are aging, of course, each of us develops numbers of, not only in biomedical terms, but in even more in social and health terms, additional variables that put us in different groups and in different groups of needs that we are developing even every day. So we also have to look at definitions. What do international organizations, for example, understand by healthy aging? And the WHO is just preparing the decade of healthy aging, and now defines it as especially as a functional ability, which is made up of the intrinsic capacity of the individual. And we heard about this, self-care, dealing also with one's own possibilities and opportunities. But also it's mentioned the relevant environmental characteristics and the interaction between them. And here we also heard already that here in this region, this interaction seems to have worked over the past years. And the question is, what does this do with those users, with those persons that might probably have difficulties to deal with the needs they have? And we were used for a long time that informal carers, family, friends are an important source. Then perhaps the social care system or the healthcare systems. But here we often saw a difference and a divide between these systems that have different cultures, different professionals, different skills developed over the past years and over the past centuries, we have to say, while over the past 3 decades, we have seen that especially that between these systems, something is developing, which we call, and now more and more organizations are calling, and countries are calling it long-term care, which is something linked, coordinated, even integrated sometimes between the two systems. And then we also see the difficulty between formal and informal care systems, because often these informal carers, family, friends, are seen by the formal care system as a disturbance rather than a resource. So we have to work on this also with volunteers. And this new long-term care system that is slowly emerging in most countries has now become also on the international level something that has been detected by WHO, EU, and many countries. So what we see here in the Basque Country is quasi a small laboratory where this development of long-term care has really developed well, because we have this outstanding success of the healthcare system. People are living longer, but they are living longer also with care needs. And we have difficulties in all our societal institutions how to deal not only with longevity as such, but also with the long-term care needs, because we are still thinking, our mindset is still, well, the family, oh, well, women can do that anyway. But all this has changed. We have heard all this already. Society has changed. Women have changed. The society and the societal and the needs of older people have changed such that it has become, for many, even professionals are overburdened with some types of long-term care needs. And so we also find here a role conflict and a conflict within society with our own old mindsets as against reality. And reality must be that long-term care is a social risk that needs solidaristic support. I mentioned already WHO has also found long-term care as a priority area for a healthy aging strategy, and asks all countries in the world to develop a long-term care system, which we currently don't have. Also in the EU, the term long-term care has appeared only in the early 2000s, and then although the EU is not responsible, of course, for long-term care, there are a number of activities that have developed on this level. Just a few ideas. What are the key strategic questions when it comes to develop a long-term care system on a national level? First of all, we have to define what we understand by needs. We have to address the formal and informal care divide. We have to address the health and social care divide, and financing and resources are playing an important role here. Assessment, just to show you, these are different percentages of people in need of care according to national definitions. And this does not mean that in Ireland there are less people in need of care, 50% less than in Finland or Austria. But it means that there is a different definition within the national law. So you can also define long-term care away, it's the easiest way, but actually you will face problems because this will have an impact in the long run, because you can put all the pressure on informal carers, but actually what you would need to do is to assess also the informal carers' needs, because we know that in many cases carers who care for not only as 50 years ago, perhaps for 2 or 3 months or years, but carers who care for up to 10 years or even more, they then become care dependent themselves. So we need also prevention mechanisms on this level, inform, counsel these people who have chosen to do care in the family. We have to work together with the dyad of person in need of care and families, friends in the future, also much more friends and neighbors in the neighborhood. and enhancing daycare, respite services for carers in order to support this important resource that will always be there. We need partnership working across sectors and across organizations, and this we have seen in so many pilot projects, and I hope that your pilot project will finally be one where this is working, where partnership working is really done not on a hierarchical level where one defines what is partnership working and the others are doing it, but that this is really on an equal level. We need, therefore, in the future, we have to think about new professional profiles. Currently, we have staff working in long-term care that is either trained in health or in social care. And for many things, still not really prepared. And therefore, and I come back to professionals in a minute. So this will be important, and we need new types of funding. Because currently, we are funding services, tasks. Maite said it already. This is what professionals are trained for. But organizations are also designed to provide services, and they get paid for services. And then you only look at your service, your task you are doing, and the long-term care system, health and social care, are really systems that show best, that give evidence to the theory that everybody is doing his or her best. No nurse, no social worker goes out in the morning and says, today I will really work badly. Nobody does this. Everybody does his or her best, but as a system, it doesn't work because we are not thinking together. And perhaps if we think about funding systems, we also need to think about how do we get away from fee-for-service to something like bundled payments or shared savings or even capitation, where the different organizations that are now already in your strategy, that have developed the strategy, also work together to develop what you call already an ecosystem, but that this ecosystem really creates value. To finish this, actually the region here is a good example for this change from the old paternalistic welfare system via the ecosystem and the new public management we have seen over the past 20, 30 years, towards something that could be called an ecosystem that creates additional value, where the person is at the center, where prevention and formal and non-formal participation plays an important role, and where we eventually will define outcome financing. One final, if I have 2 minutes, just an example also to underpin your efforts, and you have already shown that change is possible. My favorite example from Europe for change is possible in long-term care is the Buurtzorg experience in the Netherlands, where a few community nurses started with a new way of organizing work and organizing home care. And this was only 12 years ago now, that a small team of 10 to 12 community nurses started to work from the inside out, especially from exactly from the user to the community, neighborhood, and to other systems in the neighborhood. They organized small teams. And if one team then had enough clients, they founded a new team in the next neighborhood. And so they grew from one team to now over 900 and they have more than 10,000 staff members as non-profit organizations where they revolutionized not only the delivery of home care, but also working styles and the organization of work in this area, and this for less cost and better quality. And I think that this could be a good example to follow also in some of your projects at least. Thank you very much. I hope we have some time for discussion.